Have you ever considered using steroids? A banned anabolic steroid that promises to increase mass 5 times more than normal. But because it's banned, we already know that it's quite dangerous. In today's video, I'm going to explain the pros and cons of this substance that causes so many doubts among gym-goers. First of all, you should know that not all steroids are created equal. The term steroid refers to a biologically active compound. Drugs such as corticosteroids, which help treat inflammatory, allergic, or autoimmune diseases, are also considered steroids. Corticosteroids may also be used to treat cancers such as multiple myeloma, mycosis fungoides, leukemia, or lymphoma. Other uses include treating allergic or anaphylactic reactions to medicines, foods, or insect stings, and treating serum sickness. Although many people already know that this drug is a steroid, you may be surprised to learn that cholesterol and estrogen are also steroids. All drugs have side effects, but the prejudice comes when we talk about anabolic steroids. These steroids are used to make your body bigger. They have the ability to mimic testosterone in your body. For example, a normal man produces about 4 to 9 milligrams of testosterone per day in his testicles. With the use of synthetic testosterone, this can reach up to 1,000 milligrams per week, depending on the dose you use, and your body will treat this testosterone as if it had produced it itself, causing the testosterone to enter your cells and bind to what are called androgen receptors. It then binds to the nucleus and DNA. This whole process will activate numerous genes that stimulate protein synthesis and reduce protein breakdown. And the result is clear. Your muscles will always be full of protein, which will consequently increase their growth, because to build big muscles, you need to build more protein. Imagine going from a normal level of 5 milligrams of testosterone a day to 100 milligrams. This is how steroids help muscles grow fast, and why they are so famous in the bodybuilding and fitness world. Not only do anabolic steroids improve protein production, they also increase the number of nuclei found inside muscle cells. These nuclei, called myonuclei, act to control each muscle. As a result, the more nuclei you have inside your muscles, the more likely they are to grow. And like I said, our bodies already make their own steroids. An example of this is genetics. That's why other people find it easier to gain muscle. Even without training, they already have a more developed body than others, because they have more nuclei than others. Understand that muscle fibers are limited to a maximum region that the cells can control. This region is called the myonuclear domain. When the growth of a particular muscle fiber exceeds this domain, the only way for that muscle to continue to grow is to add even more nuclei to that cell. And this process is called myonuclear addition. The problem is the time it takes for that nucleus to appear. For example, it would take months for a person who trains naturally. For these reasons, it's difficult to gain 10 kilos naturally in just 1 month. But with steroids, it's a different story. You can gain muscle much faster because you significantly increase the rate at which your body adds nucleus to your muscles. And once added, they stay there for the rest of your life, unless you get sick or lose a lot of weight. This has been proven in several studies on mice. 90 days after stopping the steroids, the muscle mass of the mice was normalized, but the extra nuclei remained. So we can see that steroids not only increase muscle mass in the short term, but also increase the ability to generate more muscle, and it becomes lifelong. Of course, if you stop using them and stop training, your mass will decrease. This is normal even without using them, but the nuclei will still be there. Remember that the use of steroids must be accompanied by a professional. There are much stronger steroids on the market that can cause damage that will last the rest of your life, which are banned for use, but there will always be someone who will influence their use. Do your research, talk to trusted professionals, and never use them thinking you'll get strong overnight. It's also worth remembering that anything in excess is bad for you, and that sometimes a drug you buy at the drugstore can have more harmful effects than a single dose of testosterone. But do you know why anabolic steroids actually exist? The most common medical use is to replace this hormone in men who don't produce enough of it. Anabolic steroids may be prescribed for a number of medical conditions, such as helping patients who have suffered serious illnesses, such as prolonged infections, or even malnourished patients in certain types of anemia to gain weight. However, some people, especially men, even if they don't have any of these hormonal problems, start pumping themselves full of anabolic steroids. The result of these applications is high levels of these hormones, much higher than natural needs. In the past, the users were basically top athletes who wanted to improve their performance in certain sports, which is what we call doping. Nowadays, we see their widespread use by ordinary people, usually gym-goers, who want to improve their performance faster and for aesthetic purposes. But be aware that their use has its complications. There are various risks and side effects associated with the use of anabolic steroids, among which I would like to highlight heart problems, such as drug hepatitis and the development of tumors, increased blood pressure and changes in the cholesterol profile, mood swings, such as aggression, as well as psychiatric disorders such as anxiety and depression, liver problems, an increase in red blood cells, which is nothing more than the formation of clots in the blood vessels, and consequently an increased risk of thrombosis. In men, the use of steroids affects the size of the testicles, making them very small, reducing the body's natural production of testosterone, and consequently the formation of sperm. In most cases, this problem with the testicles can be reversed when the man stops taking androgens, but not everyone is so lucky, and it can take a long time to normalize. Some men's testicles may remain atrophic and poorly functioning even after they stop taking the medication. Another very common effect is unwanted male breast growth, also known as gynecomastia. In women, androgens cause the male virilizing effect, leading to the appearance of hair on the face and other parts of the body, as well as thickening of the voice and growth. In adolescence, androgens can cause premature closure of the growth cartilage, resulting in a decrease in final height. There are two other aspects to consider. The first is the way you use it and your dependence on it. As I mentioned earlier, there are different types of synthetic androgens with different properties. Most people use several of these hormones in combination to achieve more muscle mass and the desired body definition. They do this in cycles, interspersing periods of use of one substance after another, followed by periods of no use. When faced with such high doses of these hormones, the body stops producing the male hormone testosterone. And when you stop using the steroid, there is a sudden, often prolonged drop in testosterone production known as the rebound phase. It is during this phase that the user loses control, as it can cause erectile dysfunction, loss of muscle mass, decreased or absent libido, and various other problems. All of this leads the layman to take more and more doses of steroids to avoid these problems. The longer they use these substances, the greater the risk of the aforementioned diseases, such as liver problems, anxiety, depression, erectile dysfunction, and others. The second aspect is a much debated issue among users: the dose. Is there a safe dose? Is there a safe duration of use? I've done a lot of research and I can answer that there is no safe dose or time for the use of these substances in people who are just looking to improve their physical development and for aesthetic purposes. In patients with clinical indications for their use, patients with serious illnesses, or who really need this substance, the benefits outweigh the risks. And since the patient needs it, he or she should certainly be accompanied by a qualified professional. Many other health professionals, even doctors, have their own conclusions about its use. When there is this kind of controversy, it is best to follow the advice of medical experts. Medical societies generally do not recommend the use of anabolic steroids or even testosterone in patients who do not have a deficiency of this hormone or any type of disease that could affect its poor production. These are some of the harmful effects that steroids can have on your body, and you've probably heard that there's no harm in using them, or that they can cause harm. We can't rule out the possibility that genetics also plays a big role in the effects, both good and bad. If you have any doubts, or if you are using these substances and want to stop, see an endocrinologist who is the most qualified professional to help you. Remember that growth hormones are also considered steroids and can cause the same problems as those mentioned above, and that some drugs found in drugstores can cause the same problems in excess. Anything in excess is bad for you, so only use what is recommended and when you need it. These are the pros and cons of using anabolic steroids. We can see that the consequences aren't worth it, because just as they benefit us, they cause irreversible damage that we can carry with us for the rest of our lives. However, if you still want to use them, do your research and talk to someone you already know very well. Not that this will reduce the side effects, but you'll be taking less risk